Yeah. Well, thank you, Dr. McDougall, for being here for us and for every week bringing a very interesting topic and allowing people to ask you questions. So,
well,
how are you doing this week?
Did we have any residual from last time? We were talking about high blood pressure, and I'm still writing that business about more aggressive treatment of high blood pressure, and I think it's wrong. You know, articles are coming out every day about triple this 3-drug therapy to make your blood pressure 120 over 80 or 70, as opposed to the usual standard, which was 140 over 90. And there's a lot of argument there. And of course, the journals, the New England Journal of Medicine, just had a piece. I don't know what I did with it. Oh, yeah, I did. They just had a piece in the New England Journal of Medicine about how this is, a lot of money we're talking about. You're talking about here, this right here. You're talking about millions and millions of dollars and millions of new subscribers. They say there'll be, with these new standards, 120 over 80, as opposed to 140 over 90. Those used to be the targets where when your doctor treated you for high blood pressure with drugs, that's where the doctor would try and go. Because if you go too low, say the bottom number less than 80, what happens is you get a problem with perfusion pressure into the heart and lungs and other tissues. As a result, you have an increased risk of stroke and heart attack, 2 to 4 times the risk. So doctors question this aggressive therapy. This particular issue, this is a January 9th, 2018, of the New England Journal of Medicine. They say the new goal is 130 over 80, and the old goal was 140 over 90. Increase the number of people, listen to this, the number of people who have high blood pressure just by changing the definition. This is the way to do business. Just by changing the definition, the number of people in the United States who have high blood pressure went from 32% to 46%. Isn't that amazing? Just by changing the target for your blood pressure, you have to use 3 drugs with the intensive therapy and 2 with the standard therapy. Anyway, we'll talk about that sometime later. But I do talk about they're starting to talk about the money aspects and the side effects of doing this. And really, it's just another drug company way to sell more drugs and hopefully not hurt more people. But that's the problem, is they end up hurting more people. Okay. Right. We wanted to talk about flu today.
Yes, that's correct.
Let's see. We have a medical letter on flu. Yeah,
I don't know. I don't know over there or anywhere else, but everybody seems to be getting the flu around here in Texas.
I think I got it too around Christmas time. It says some of the kids over.
Yes, right.
And I think I got a pretty bad case. At least Mary says I wasn't very much with it for quite a while, like 4 days.
Well, I think that sometimes people have a misconception that if we eat healthy and we eat this way, that we're going to be immune to every single thing. And I
guarantee you, if you get hit by a car, you will get broken. All right, I think I got enough stuff. Okay, so I looked at what they were saying about flu and its effectiveness this year. The vaccine, the ever popular vaccine. Now, why do I say ever popular? Because every time I go to CVS Pharmacy or Safeway, I see a sign that says outside, "You will get your flu shot."
Oh, yeah.
I'll give you 10% off on your groceries. And I can't call the pharmacist to call in a prescription without hearing a pitch for your pneumococcal or influenza vaccine. Every time you call as a doctor, I get a sales pitch before I can even talk to the pharmacist recorder. I got to listen to this advertisement for a flu shot. And they should be advertising them because they're not very good. Okay, Mary. Oh, there it is. Thank you. If it wasn't for Mary, I'd lose everything. Oh, about the low vaccine effectiveness for 2017-18. I wrote a whole paper on this subject. Yes. I wrote it in my November 2014 newsletter.
Okay. That's November 2014.
Yeah, November 2014. And nothing's changed except it's worse. They were complaining back then. I lost something.
Oh, okay.
But you know me. I lost it right there.
Oh, okay.
Okay. I say no to the flu vaccines. I've been saying no to flu vaccines for probably 15 years. I think it's the last time I got one.
Mm-hmm.
Maybe longer than that. Maybe as long as 30 years. And I'll tell you why. They had the swine flu. I was a general practitioner. I was actually a board-certified internist. But I was practicing in this Dungy office. And, of course, when you're a young doctor, what clientele you get is largely, oh, boy, I don't know how much trouble I'm going to get in for this one. But they're largely drug addicts who are to see the new doctor, to see how easy he or she could be talked into prescribing Percocet or codeine or whatever. And so that's your first patient load. But, I started collecting after a while people who were really interested in what I was interested in, which is take care of the problem with food. That year, that must have been 79, 80. There was a swine flu that came out through. It was really, really terrible. And I saw a lot of people. I saw a lot of patients. And I saw 2 patients came through my doorway who could no longer walk. They had transverse myelitis. They are infected in their spine. A piece of their spine died, and they could no longer walk. They're paraplegic. And that is a side effect of these vaccines. Guillain-Barré is another one, which can paralyze lots of stuff. So anyway, I at that time said, I don't think I'm going to get the flu. And I think about that time I had also had a flu shot. And that year I got three times I was sick, so sick I felt my head. Yeah. So I stopped taking any flu shots until the scary, it was about 5 years ago, swine flu epidemic that came through. And the problem was at that time is there was no vaccines available. They hadn't geared up for what they were expected to get. And so the only people able to get swine flu vaccine of that era were doctors and nurses and other public officials. So me being in that category, I went down and got 19 injections, had them sent to me. My neighbor couldn't get them. Nobody else could get them, but I could get them because I was in the medical field. And I put them in the refrigerator. I hadn't taken flu vaccines in a long time, but I put these in the refrigerator and I said, this may be real serious. And I'm going to start giving them to my family as soon as my neighbor dies. Well, my neighbor never died. So up until a major event that occurred this October, they were still in my refrigerator. Anyways, people are concerned about some of the things in these vaccines. Some vaccines have toxic mercury, but the influenza vaccine doesn't. It does, I believe, have aluminum in it. But the problem is the effectiveness, the lack of effectiveness. There are side effects, allergic reactions, fever, fatigue, headaches, but the lack of side effects. Well, this year, I went through, looking through, they say things like they say, in this particular paper, I'll just show them to you quickly for the long one. Stop and look it up. They were looking at the Australian epidemic that just occurred. Of course, there are a couple of seasons behind us. And what they found was the vaccine effectiveness during 2017 for the deadliest kind of flu, which is called H3N2. The effectiveness was 10%. That's what they said, 10%. And let's see. It's actually a paper in the New England Journal of Medicine. Oh, here we go. Here's one from Britain. This just came out recently. This is January 20th, 2018. And, what they tell us is influenza H3N2, which is the name given to the really bad one. They mutate faster than other viruses do. And as a result, they become very ineffective. As I say, the best guesses are 10% of the people. But even though they'll tell you the honest truth in CDC and so on, they'll still tell you to take the flu. They say, well, it may help you decrease your risk of something by 30% or 40%. Of what? Not that specific flu virus. That specific flu virus gets hit 10% of the time when you get immunized.
Right.
I'm just going to take a minute now that I found my paper. And Gustavo and I are going to get better at this, showing things on the slide. But this is the problem. Okay. Is that okay?
Yeah.
Okay. You
Yes.
see the green ball in the center. Green ball is the virus. And the yellow and blue objects are antibodies. Okay? So that's the virus that goes through the nasal passages, through the mucous membrane, or through the bloodstream or skin or whatever. Eyelids. The green guy. And there are, of course, hundreds of millions of those green guys. Well, the body makes antibodies, which are the yellow and blue things, specifically against a specific green body virus. In other words, the antibody it made for last year's virus won't work on this year's virus because they change. The viruses change so fast, they mutate, that the body can't pick up with designing the appropriate virus for that particular mutation, at least fast enough for the scientists to get a hold of it and to grow it on an egg media. So the virus that is troubling so many people this year, they thought they had it. They thought that this was going to be a really successful flu year, and now at best it's predicted to be a 10% success rate. But they tell you, you can't. By the way, you can't use the mists anymore. That's been determined ineffective. So you can't
really?
Ineffective and too dangerous for adults. They have a high dose vaccine for adults and really sick people. And the difference in influenza illness is 1.4% versus 1.9%. But they still go on and tell you to take these ineffective vaccines. And they do it every year. Even recommended for pregnant women over the age of 26. No, how hard they try. That virus, the H2N3, this is out this year, all the viruses do it. But this one in particular, it mutates to another structural composition. And so the body has to make new viruses to it. Well, they sent the old virus, off to the lab to make millions and millions of doses of vaccine. But by the time the vaccines were ready for market, that virus in the environment has already mutated to a whole other virus. Now, one of the things that they find troubling about this is the media that we grow them on. Almost all of these viruses are growing on egg media. And the egg somehow encourages this particular virus to mutate more readily. So we have a real big problem this year with the, I'll show you again, Green guy's the virus, and the red ones are red blood cells, and the yellow and blue, they are the antibodies that are made to kill the virus. And all those little prickly points you see on the green thing, they're amino acids, proteins, the kind of things that the antibodies make, the lymphocytes make antibodies to, are those specific proteins. Well, you can tell there are millions and millions of proteins there on that virus. And it changes to a new kind of virus before they can get an effective virus made. So the number one thing that you ought to hear is, in fact, this is considered a worse failure than previous influenza viruses, the 217 to 18. It's considered the worst as far as effectiveness. Mm-hmm. And more people have gotten the flu, and the flu has been more sickly to people than in the past. Hopefully this is not a trend. What they want to do, what they hope to do, somebody wrote up there, flu vaccines actually spread the flu. Well, I'm just sticking with what I know scientifically. You can, never mind. Let's just say they don't work. The best thing to do is this: is you stay away from sick people. That's the best thing. I think what I'm gonna do from now on, Gustavo, is in your summertime, I'm coming and visiting, which is the time coming up right now. And then you can come and see me in my winter time. So whereas Australia suffered this terrible flu in what is North America's summertime, North America's summertime, Australia had the wintertime, and they got the flu. So avoiding sick people may be one way. We should all take a flight to New Zealand or Argentina or someplace to get out of the flu. Did they have a bad flu epidemic in Argentina?
No, they don't. They don't. I don't know why.
Yeah. Well, the other practical things to do are to stay away from sick people. I mean, don't go to the grocery store when it's really crowded, and don't go where you know your relatives or friends are sick. And also, the other thing is your hands are a great vector for spread. Mm-hmm. So what I would suggest is, whenever you get a chance, you're out. You just finished dinner, you just walking down the street and the restroom appears. Just wash your hands so that you can help stop spread that virus. And I still don't recommend influenza shots. Why? Because they're ineffective and they're worse this year than previous years. I do, however, and this is the one that's going to make somebody upset, but I'm not here for a popularity contest, is I do offer vaccinations to all of my family. All of my family have been immunized for DPT, polio, hepatitis A, hepatitis B, to pretty much everything. And the reason is because these particular microbes, be they viruses or bacteria, they don't have that changing protein. Okay, it's very stable. A smallpox vaccine, right, which was developed a long time ago. Cowpox first and then smallpox. The smallpox virus hasn't changed. So the body can make an antibody to smallpox. And then later on, that antibody, which is picked up by scientists and refined and so on, that antibody can be concentrated and given to people as an injection, and they become sort of infected. The virus is dead, so it doesn't really make them real sick. They become sort of infected, but the immune system learns what a smallpox virus looks like because it doesn't change, not like the flu virus. So it learns what it looks like, and then it takes about 2 weeks, by the way, for this learning process to take place. About 2 weeks for the body to fully understand this invader and to take action against it. So now you have this smallpox vaccine, which fortunately they put it away because there's no smallpox, at least that's what we hear. And if it ever did become a problem, say we had germ warfare, you'd find smallpox vaccines spread all over wherever they could get them. And you'd be grateful, too, because it does work. It'll stop smallpox, which has killed millions of people. Smallpox vaccine is not available because they can find no cases. That's what they say. There are viruses around stored away in banks and so on. But you can't buy smallpox vaccine. I've tried. If I could get smallpox vaccine, I would vaccinate all of my family, my children and grandchildren, because I can't see a day where there is germ warfare. And anyway, I believe in vaccination. It's just that the flu is too darn smart for the body, the eggs, and for the scientists. And so, my recommendation to people in general is take advantage of this miracle. Immunization is one of the 3 miracles that has changed the number of people living on the earth and improved the welfare of human beings. Sanitation, good nutrition, and immunization are the only 3 things that have made a difference as far as how many people live well and long. So,
Dr. McDougall, what should someone do when they actually get the flu? What would you say?
I thought you were going to ask that.
Well, everybody's asking that.
There's some drugs out there.
I mean, once you get it, is it too late to do anything? Or just rest, drink water, what?
Too much. I knew you were going to ask that, so I went and got my medical letter last night because I've got a review on these things too. I can't remember all this stuff. And there are antiviral drugs. This is the medical letter, which is I've been getting this since medical school. This is how I get my CME credits. So I stay up to date on medicine because I have to get credits, and so I take this particular letter. It's all about drugs. Why would I take a letter about drugs? Because I don't know very much about them. No, so I have to learn, and this is a good way for me to learn so that I know everything they know. And when they start talking about the drugs or the effectiveness of heart surgery or so on, I've read it in the medical letter, and it's a pretty honest letter, but they do recommend that you get the flu shot, even though it doesn't work. There are some pills and shots out there that you can take, and also an IV. There's Tamiflu, Relenza, and how about Rapivad? I'll go with that. Tamiflu, by the way, has had a lot of controversy around it, especially in the British science, but I guess to say it works now. Anyway, you can buy for $98. You can get the Relazanimir for $59, or you get this injectable vaccine for $950. So you could take it prophylactically. In other words, if you think you were exposed to somebody with the flu, they'll give that to you. And they say it's about 79% effective, but I don't believe that. I don't believe they had found ways to measure it. These kinds of antiviral drugs, they're not immunizations. It's a whole different category of drugs. These drugs, they may reduce the duration of illness by 18 hours, they say. And that'd be nice. I'll tell you, I hate giving the flu for any time. And if they're safe,
right.
Some are safe in pregnancy. Yeah. But I've never taken myself.
Do you think, Dr. McDougall, that hand sanitizers make any difference at all, especially like airplanes or restrooms where there's a lot of people?
Oh, do I think it makes a difference? No, I just can't imagine. Because you sanitize your hands and then you reach down and you just picked up another 10 million, whatever. If you isolate yourself, you go to the shopping store, you wipe off the sharp and tart handles, to minimize your.
Right.
And you don't go and stick your finger in your eye or in your mouth,
in your mouth.
things like that. And then you get away from that environment, get your groceries packed, and wash your hands thoroughly again. That's the only thing I know that has any sense in working. So, yeah, I think cleanliness, especially in these seasons of sickness, is really important. So.
Okay, very good.
So, a whole bunch of other stuff here. I don't know what you want to talk.
So the same thing with people ask, what about taking vitamin C or eating mushrooms or whatever?
Echinacea, vitamin C. Hey, I want to tell you, I read all the research on those things, and I know they don't work. But up until a great event in October, I used to have a bottle of echinacea and a bottle of vitamin C sitting on my kitchen counter.
Yeah.
I know they don't work. It's crazy how the mind works. Sometimes you can believe things and you still do it just in case. I mean, what's the loss?
Yeah, exactly.
So anyway, there's a bunch of junk that came out in the paper that I thought was kind of interesting. Corn syrup lobbyist is helping set the U.S. dietary guidelines. And this went on before our current administration. Industry getting in there and setting the guidelines for people. Now we have somebody who's a lobbyist for the sugar industry. The risk. Now this is something I want to talk about. The risk of Donald Trump dying of a heart attack. No applause, no boos. The risk of Donald Trump dying of a heart attack. That was January 16, 2018. He went for a physical, and his weight was 1 pound below obesity, and his cholesterol went from last year at 169 to 223. And I look at that guy, he's the same age as I am. Maybe he's even a little older, maybe a few months older. And I watch him and his pace. I just can't believe it. How could somebody so obviously sick, so competent, or so fat and obviously looking poorly, do so well? It kind of turns over my whole thinking process. I work so hard to eat well and get some exercise, some sunshine, and I don't know that I can keep up with that man's schedule. I really don't. And then the fact that he totally ignores any good principles of nutrition makes me again think, whoa, what am I doing here? Have I got it right? Donald Trump has proved me wrong in so many ways. Just look at him. My guess, somebody asked me, what's your guess? Him dropping dead of some serious disease. Pretty high.
Probably. Well, I not only Donald Trump, but other. I see people that seem that I know are sick, but they do. They get along. They do all this. They're active, and I wonder how many pills they're taking every day to function like that. If they're functioning like that because they're medicated or not, I don't know.
I don't think so. I just think there's some institutions, some constitutions out there that just surprise everybody. It's like the young, healthy person that dies. But I do think there is sense to, to not walking out in the street with your eyes closed and, trying to eat the best food that people believe will give you the best chance and not smoking cigarettes and things like that. But Donald, except for smoking and drinking, I hear he doesn't do either. He lives on, Burger King's or McDonald's cheeseburgers or something. He defies everything and has cholesterol that says he shouldn't be alive.
Mm-hmm. Well,
but he is.
Yeah. Don't know. Dr. McDougall, someone is asking here if someone is more susceptible to the flu if you have MS.
Is more susceptible? No. I don't believe they are. They may be more susceptible to the flu if they're on like interferon beta, which is one of the immune suppressing drugs. But that would be the connection to me. Would be the medication that suppresses the immune system.
Right. What delicious thing are you eating there?
Things like every time I do a webinar, I don't know whether the people at the factory do this or not. This is a Stay Full Oatmeal Apple Flax Oatmeal number 7. They send me these things to approve. You think we should put this one up?
Mm-hmm.
And honestly, I don't know which ones make it to the market or not. But we have 4 or 5 cereals in 6,000 stores, and probably have about 20 or 30 different meals and soups. Dr. McDougall's right. Dr. McDougall's right foods. They're not Dr. McDougall's perfect foods. This one right here has enough sugary taste to stimulate anybody. And even though we're the lowest salt food on the market, we do still have some salt added to the food. Why?
Right.
No salt, no sale.
No eating.
We made one time. A friend of mine built this factory back in the early '90s. Dr. McDougall's Right Foods. So it's been on the market a long time. Consider we're in 6,000 stores. And when we did it, we talked about sugar and salt and things like that, and we decided we wanted to stay in business. So we made it very low sugar and very low salt, but enough to give people a kick so they really like it and eat it. Well, Nathan Pritikin's group came to us and they loved our soups, loved them, and asked us to make a salt-free, sugar-free version. And we got the deposit and we made the soups. I don't know where they are right now, but I don't think anybody bought them twice. People just like salt and sugar. And if you can give it to them in a reasonable amount and in the lowest amount where they can get the most taste, like if you can, if you can make oatmeal like this is made, and this comes salt-free, by the way, or sugar-free and salt-free, and spice-free, pretty much. And what you do is you open it up, and there's a package that has the seasonings in it.
Right, exactly.
You can make it as low salt and sugar as you want. It's gotten to the point, Gustavo, I tell you, it's gotten to the point, I'm sure it's my age, where I can't hardly eat in any restaurant anymore because of the amount of salt in the food. I used to go to my favorite bean burrito places it's been going on for 30 years. Like Al Patio in town. There used to be a Sonoma taco shop, and we have, but anyway, really good burritos. We get whole beans and lettuce and clean rice and salsa, sometimes guacamole. But it's gotten to the point these days, I think it's changing my taste buds, where there's only about one Mexican restaurant that I can eat at. Right. I can't even get through the burrito because of the salt.
The amount of salt, it's
I don't know if that's changing people's practices of cooking lately, or it's changing me.
Not only the amount of salt, but the amount of oil that you find in restaurants. Even if you, even if you say no oil, I mean there is still oil. It's impossible. It's more of a torture to go out to eat than a pleasure. I guess unless you get a salad bar or something. I don't know.
Well, the people listening who have really made this kind of dietary change, that what Gustavo and I are saying is absolutely true. The food, the way we learned to eat it before, with the meat and the dairy, right? Meat, dairy, salt, and oil, and probably lots of sugar. I say that because it wasn't an issue in my case. But when people change to a healthy diet, they go back and they try their old favorites. They go, my goodness. How
yeah.
Eat something with this much oil in it.
Right, because there's a point at which you just don't taste the food anymore. The oil coats your tongue, tons of sugar and salt, and the actual taste of whatever you're eating, I mean, it's covered up. Dr. McDougall, let me ask you a quick question, because someone says, what would you say to this comment that, and I've heard it myself, the people that say, well, even if you get the flu, if you had the flu shot, the flu will not be as severe. Do you think that's
the public message? That's
the public message. That's how they sell it.
The medical letter put out.
Yes.
But they have no scientific reason to say that.
There is no scientific reason.
Not that I can find.
Mm-hmm.
This is just hopeful thinking. So they say, even though it was only effective against 10% of people, 40 to 60% benefit, even though the virus was not matched to the vaccine. They say 40 to 60% benefit anyways. And I look at that, I go, how do they benefit? And where's the evidence that says that these 40 to 60% of people who take the wrong vaccine for the virus that's going on, how in the world would you expect it to work? I think this is just, believe it or not, Gustavo, I am so pessimistic, so worried about the morals of humankind that I bet there's $1 behind this one. I bet.
I couldn't believe that, Dr. McDougall.
10% off your groceries when you walk in the store. Or they're given free if you have Medicare, and probably most other insurance companies. These are free. Why are they doing this? Why don't they give say free Viagra or free antibiotics or medicines that do work?
Mm-hmm.
So no, they every year they give them out, and they almost make you take them home.
Right.
They make you think you'd be stupid to pass off 10% of your groceries for just taking a stupid little shot.
Right.
But, people get hurt from these stupid little shots. Guillain-Barré, which is an autoimmune disease. As I told you, there were 2 cases of transverse myelitis when I was a young doctor I saw, directly tied to the swine flu vaccine at that time. Yeah, so I don't think it's something that you should take lightly. I think you should demand the effectiveness of this vaccine before you allow the pharmacist or the doctor or the aide to inject it. And right now, the data is 10% effectiveness. And that they got from Australia's last epidemic in their wintertime. And they've also got it from what's happening now. It's 10% at best. At best, people who take the vaccine are helped.
Right. Dr. McDougall, can you see in the comment box where people write comments? Can you see this one? Can you see this one comment or question by Lynn there? Do you see that? No.
Well, I guess I don't. I'll message the public.
Okay, well, this one says, I guess someone's getting home. Someone is coming to visit. Well, I thought I put it in public to see if you could see it. But anyway, she's asking this, and I don't know how to pronounce this long word, so I'll try. She's asking about the validity of clinical studies on oscillococcinum for flu by boron. I don't know if I
don't know.
Okay. Well, I will send that question to you later on by email, and maybe
unless the only other one that I know starts with an O, I told you about.
Okay. All right.
That, they say they have some effectiveness.
The
Tamiflu may be what she's talking about. Let's see. Here it is. No, it's not. Okay.
I wonder why. I know several nurses and a few doctors that I just know them, and I wonder why they don't take the flu vaccine.
Well, because they know what I know. Anybody that reads a medical journal. Here it is, antiviral drugs. The only antiviral drug that I have here, which is Tamiflu, it's spelled OSELTAMIVIR. Is that close enough to spell?
No, it's not. But someone says boiron, B-O-I-R-O-N.
Oh, yeah, the mineral boron. I have a very wonderful sister. She's just a couple years younger than I am. And she's really into everything alternative. So I don't miss all the alternative pitches. And I sometimes take the trouble to look up what she's talking about. But, too often the things that she talks to me about are supplements and
right,
which is an element. And they talk about how wonderful it is for the bones and so on. I don't see any clinical research on that, but maybe it's because I don't look. It's not a topic of great interest for me, so I haven't really looked to see what's available. But my guess is there are no double-blind randomized trials. And the reason there are no double-blind randomized trials is because there's no money to make. I mean, how much is a big box of boron? A few bucks?
Mm-hmm.
Well,
I don't think that they were asking about the mineral boron. They were asking about this. It's a homeopathic remedy that is in all of the Whole Food stores, and it's boiron. It's a product, but
I don't know.
It's not. Okay, you don't know that. Okay.
No, I don't know. See, I don't know a lot about things sold in health food stores. I'm just kind of a food guy. I'm kind of sweet potatoes.
Exactly.
And I'm a doctor that asks people to stop medications that aren't necessary. That's the two things I should be known for, is that I have an intense interest in a starch-based diet to prevent and cure illnesses. An intense interest. And that's Mary. And also, see, I believe, Gustavo, you have to understand, I came from a training of belief. Medical students, residents, doctors, they believe. And so when somebody tells you heart surgery saves lives, you just say, why would they lie to you? Or, that these diabetic drugs will reduce your risk of dying of heart disease. Why would they ever lie to you? And so you just believe and you pass it from one doctor to the next. Well, fortunately, I had a curiosity. I wanted to see, It started out with arthritis, with rheumatoid arthritis. I got a brochure on my desk, and it's in one of the newsletters. I think it's May 14, 2014 newsletter. Anyway, I got this brochure on my desk from the Arthritis Foundation. And it said, no diet will cause, nor no diet will ever cure arthritis. And they even left gout out, which everybody knew was a dietary disease. So you're a quack, they said. Hi, Mary.
Hi, you told me you wanted me to
come on,
so I'm here.
There you are.
She's going to be, are you going to come to the intensive weekend?
I am going to come to the
Oh, sure, kid. So we're both going to be there, and I think it's like 4 or 5 days.
Yeah, it's this week. It starts this Friday. Yeah.
It's the 7th through the 9th?
No, 9th through the 11th.
9th through 11th. Yeah. So if people want to come there, I know there are over 150 people coming already. But
that's great.
We got great meals, and Gustavo and one of his daughters.
Yes. Well, this is one of the best weekends to spend with you all.
As far as expense goes and exposure goes, you can't even come close to it.
No, you can't.
We'd love to have you at the 10-day program, but
right. That's when you can really, really get all the medical care.
But Mary and I are very lucky. Even though we've been, as some of you know, been through some considerable changes, we're very lucky to have each other. And
you can get through everything together. That's that's what it is.
She's the greatest gift God ever gave me. And so, people talk about losing your house and everything. Well, if my option was to live without her or to live with her in a cardboard box, I'd take the cardboard box.
Oh, yeah. Yes.
Great time to go flying airplanes and sailing sailboats and skiing down the hill with kids. And What are we going to do next for fun? Buy a new house.
Buy a new house.
Well, it's wonderful to see you both together.
Yeah, we're running programs regularly, same schedule, same great attendance, same great output. And so, yeah, we'd like to see you. This intensive weekend, we won't have another one for 6 months, but there'll be 10-day programs coming up.
Right.
So come on and have some fun with us. You'll meet people who think like you do. You won't think the whole world is crazy or that you're crazy anymore.
Right. Exactly. Because when you're out there in your little town or city and you're the only one, sometimes it makes you question what you believe. But being around people that believe and think the same way is very powerful. Well, you too.
If you can get some topics for next week, fine. If not, I will try.
Well, what we're going to do, Dr. McDougall, is that next Saturday or Sunday, I think. Well, you and I are going to do the webinar live from Santa Rosa, since I'm going to be there.
I'm going to do it live.
So everybody, we're not going to do it on Monday. It's going to be on the weekend, and we'll send an email today or tomorrow.
It'll be on Monday.
Yeah, it's not going to be on Monday. It's the Monday webinar we're going to do on Saturday or Sunday.
Yeah, but we're going to play it on Monday.
Well, no, I mean, it's going to be live. Then we can replay it on Monday again.
Okay.
But people should be able to watch us live. Yeah,
okay.
And we can show them the dining room, and we can, maybe show a little bit of everything.
And crowd. And
yeah, they like that.
Yeah,
okay, no. Yes.
I was just going to say, by the way, that was one of the things that we were worried about in October, was that the resort would burn down. 2 other huge resorts, the Hilton and the Fountain Grove.
Oh.
Burned down.
No.
So after we left the fires, after our home was gone, we went to the Flamingo. And we stayed there for about 4 hours and watched CNN News, and we just kept hoping. Yeah, actually, I'm such a person of optimism. I knew for sure the fire.
Did your house was okay?
My house. They were going to tell me to go back in 6 hours and to.
Oh, sure.
Dust off a little smoke and everything would be fine. But then about 6 in the morning, we got evacuated from the Flamingo.
Yeah.
And, oh no! Now we're going to lose our place of business. And fortunately, that didn't happen.
No, that didn't.
You get close to the Flamingo, so it's just beautiful, unbelievable.
Yeah, yeah. Well, Dr. McDougall, I think we're getting.
I want to stay at my house when you come. Bring your tent.
Oh yeah, that's right. Yes.
There's no running water. There's a full swimming pool, but you can bring your tent. You can't
yes.
You wouldn't want to stay. It's such a toxic waste. Oh my God.
Oh my goodness sake.
But anyway,
that's terrible.
All
right. Well, let's close the webinar with this question that someone has. And it says, she says, I believe that most participants in this webinar are looking for an effective remedy if we should contract the flu. What would Dr. McDougall do if he got the flu?
Well, what I do is I lay down on the couch and ask everybody to leave me alone.
Yeah.
And try and drink as much water as I can. I did have the flu. I don't know. I just blame little 2-year-old grandson. Got to have somebody to blame.
You do have to have somebody to blame.
No, I mean, I get sick. I think I get sick less often than most people, but that could be just wishful thinking. And I think when I get sick, I get less severely sick than other people. But again, that just might be wishful thinking. The last time I got the flu was, I think it was the bad one.
Mm-hmm.
H2N3, whatever it is.
Yes, yeah.
I got that one. I spent 4 days just laying around, and then took a while. Usually, the flu takes a really good flu. Not one of these wimpy colds.
The good
flu is going to knock you out for about 6 weeks.
Yeah,
2 weeks really badly. So you don't feel like working at all. And then another 4 weeks, things may not be so good. That's been my experience.
Yeah.
And I just to go back to what I said before, one of the equations to me, parts of the equation for me to come to the decision I wasn't going to take flu shots anymore, is one of the years, the last year I took them, I got sick, that sick 3 times. And I said, I don't know what flu it's looking for, but I sure didn't find the 3 flus that I got. And again, these are just unscientifically founded conclusions, of my experience. But the science is there that says that the current flu vaccine is ineffective. Less than 10% of people are benefited. And the idea that you might as well get it anyways because 40 to 60% of people will be mildly benefited is somebody's dream. Somebody manipulated some data or came to some hopeful thinking and decided to tell people, look, we've got 1 billion flu shots out here to sell. How are we going to sell them? Especially when we have to tell them it doesn't work. Well, we'll tell them it sort of works. Got to get it anyways.
Yeah, and if you get the flu, it'll be less.
That's right.
So that's a good tactic.
They can tell you that. But they don't have the evidence for that. So
right.
Just a big fat lie. But they do have evidence that says that the flu shot doesn't work. And it's all over the scientific research. You can read it. I hope you have a good day.
Right.
Okay. Listen, I hope you have a good day. So, nice
Thank you.
And hopefully we'll have something really outrageous to talk about. Actually, I don't want that. I want to close with this. Because every day when I turn on the news, I hope there's no news. And likewise, if we have a big medical story next week I need to talk about, I really don't want to have that. I don't want to have those kind of tragedies facing people that are news reportable. So hopefully we'll have no news next week, and you'll have to send some good questions to Gustavo, and I'll try and tell you how I practiced and the success I've had with my patients.
Yes.
So,
very good. Well, thank you. Thank you again. And I'll see you live on Friday. I'll see you
for mashed potatoes. And,
yes. Oh, that food is marvelous.
Yeah, great meatloaf. And I don't know, that's bean burritos. Heather always picked the favorites of everybody's, the greatest soups.
Yeah.
Anyways, there's still time to sign up if you'd like. It's in Santa Rosa, California.
All right. Very good. There's still time. Yeah. People can go to drmcdougall.com and still register there. Okay. Well, thank you.
Thank you, Gustavo, for making this.
Okay.